right. So just a little bit of introductions here. I am Rebecca Royce, Clark County Program Coordinator. I work with a lot of the community action programs and some of the homeless crisis response system programs. Beth, do you want to introduce yourself?
Good morning, or good afternoon, everyone. Apologies, working through a migraine and about 80% here right now. My name is Beth Landry. I'm with Clark County Community Services, and I work with a lot of the homeless programs, rapid rehousing, PSH, things of that sort. And we also have Michael with us here today.
Good afternoon, everyone. Michael Torres with Clark County Community Services, and I'm the program manager.
So we are recording this meeting, and so we will make it available afterwards. We are also doing another meeting Thursday morning at 8 a.m. for those that could not attend this meeting. You do not need to attend both. It'll be the same content. We're just making it offering the discussion so that more people have the opportunity to attend. If you have any questions, don't hesitate to put them in the chat and we'll read them out loud, or you can unmute yourself and ask those questions. If you do unmute, please state your name so we know who is asking those questions. If you prefer, WebEx does offer closed captioning, and so you'll see on your screen a little icon that looks like a little robot with a CC on it. You can click on that and it will show you how to turn on the closed captioning. And if you need to lock participants for any reason, here's some information on how you can do that. We do not have any interpreters on the call today. So first we wanted to do just a really brief general overview of Bonfire. Bonfire is the program that we'll be using for the application submittals for both the homeless crisis response system and the community action programs. Some of you might have used it previously with the last request for application that we had for the COVID response dollars. So it is the same system for these two RFAs. And please don't get them confused with the home and CDBG RFAs, which will be submitted through Neighborly. Once you click on the link for the opportunities, you will pop into this screen and you'll see that there's two that are available right now, one for the homeless crisis response system and one for the community action program. So please make sure that you click to view the appropriate opportunity for the program that you are interested in applying for. Once you get into Bonfire, your screen will look very similar to this, but not exactly. So we just wanted to give you a quick overview on what you can see when you get into Bonfire. This is one of the most important screens. It's files. This is going to be where all of the documentation is listed that gives you all the information you need for submitting your application. It has the descriptions, it has the definitions, and it has some of the required documents that you'll see are required for submission with your application. You'll see that this is under public files and also mentioned here. Another important tab for you to know about is the requested information. This is where we've indicated what we are asking you to submit with your application. So we are requiring that you submit a annual budget. There's a template for that in the files portion of the site. You will also see the questionnaires for the application. This is what is going to get into your program information, what you're actually submitting for your application. To get to those questionnaires, this is the same tab, but it's under this menu item right here called questionnaires. And there are 3 questionnaires for the RFAs. One is a pre-application, one is your main, or the other 2 are your application questions. One of them is for CAB scored questions, and then the other one is objective scoring, and that is stuff that the staff will review and score for those. We are asking that you complete the pre-application first before you move forward with doing any of the other questionnaires. And then if you have any questions or concerns as you're using Bonfire, in the main screen, so you'll see that this looks very similar to the the last print screen that we had for you, down at the bottom is a question mark. And that's where you can go in and find articles about using Bonfire or submit a ticket to request help if needed. One of the other things we wanted to make sure that you were aware of is when you go into Bonfire and you view the opportunity, if you are not logged in, you won't be able to see much of the information that's available. To be able to look at the files and to download the application information, you will need to log in to that opportunity. Are there any questions about the general use of Bonfire? Beth and Michael, did you have any other recommendations for the agencies?
No, this will be the third request for application that we've done in the past year using Bonfire, and at least the feedback we've gotten from applicants and reviewers is that it's pretty straightforward once you get in it. If things arise and the technical assistance is not enough, please do let us know so we can try to help you through that.
And I'll just add that this is Beth with Clark County. I'll add that when you create an account, if you haven't already created an account with Bonfire in the past, it is a free service. So pretty similar to just signing up for email. You're going to have your user ID, create yourself a password, and get established with a vendor account for free.
Thank you.
Creating an account, if you are a new person with an organization, is there going to be any kind of issue with that?
No, that should be fine. You can, if you would like to have a new account, you may. You can also check in with your organization and see if they prefer to have a primary shared account, whichever way was the original approach. That should be fine.
Okay.
So next we're going to go over the RFA, just general things that apply to both the community action programs and the homeless crisis response system. First of all, if you've received this email, hopefully you are already on our stakeholders list. If not, you can contact our office assistant, Janet Snook, with this email, and she can make sure that you're on our stakeholders list, and that way you'll be notified of any future funding opportunities. The application submittal, so as we were talking about, the applications will be submitted through Bonfire. To view or start an application, there's two ways that you can go in. You can go to our website, the Clark County website, and you can look for the link that'll be there, or you can use this link to go directly to Bonfire. And as we already mentioned, that you do not have to sign up for Bonfire to view it, but you cannot really do much until you actually sign in with an account. All communications will go through Bonfire. If you have an RFA related question, there is the opportunity Q&A menu item, and you can submit your question through that, and then we will respond within 2 business days. Questions will only be accepted through December 29th. We also, there's another feature in Bonfire that talks about public notices. That's where staff can put out a notice to RFA applicants. So if there's any major changes or information that we feel that you need to know, we will post it there. We recommend checking in on those public notices periodically. So one of the components of the request for application is to collaborate with other agencies. And we know it can be a little bit confusing about what we mean by collaborate. And so we put this chart together. We highly recommend that you read through this so that you have a good understanding. But what we're really looking for is a partnership between you and other agencies for providing services to the households and individuals that you are serving. If you don't provide that actual service, you should have a collaboration with another agency that you can work with closely to make sure that the needs and barriers of our households are being addressed. We are not looking for letters of recommendation that we fund the program for you or anything like that. We really want to see in that letter what that partnership is going to look like, what your agency is going to do, what the other agency is going to do. Another question or component of the application is knowing about outputs versus outcomes. And sometimes people get these a little bit confused of what they are. So we thought we would give you a quick definition for this. So outputs are going to be services and actions. Those are physical or transactional items that you are doing to help an individual or household. An outcome is the change that happens because of the output. And no, it might take several outputs to create an outcome for an individual or a household, but it's really the change that's happening and what we're looking for in the outcomes of these programs. Outputs and outcomes proposed in the application will be used in the contract. If you were awarded for funding, just please know that we cannot reduce the data points, the numbers of outputs and outcomes that you have submitted in your application if you find that maybe you did that in error, because these numbers are used in the overall review of your application. So to give you just a general idea.
I just wanted to like really emphasize that, not because you are not saying it clearly, you really are, but the reason I want to emphasize that, everyone, is because every year we do get questions about this specifically once proposals have been submitted, and often after proposals have been selected. And exactly as Rebecca said, this is your proposal. We are not telling you what outcomes you should submit. But do know that this is a competitive solicitation of proposals. So once the reviewing committee selects your proposal, if you are successful, and we allow after the fact to change that, that is unfair to other entities that may have submitted a proposal and did not get selected. If you know, especially if we are reducing your outcomes in that process. So please, please, please be very, very thoughtful when you are designing your program, when you are putting together your proposal. Understand what it is that you are committing to do, because it will be put in your contract based on what you proposed and said that you would do.
To give you guys just a really brief generic example of what this looks like, if you propose providing 20 widgets to 20 people, and by providing those widgets, you indicate that 20 people will run faster, that's the change, the outcome of that, then that's what's going to be included in your contract. But if afterwards you realize that, wait, people need 40 widgets because they are needing double the amount to meet that outcome, you're going to need to meet the outcome that was proposed in the application and find other ways to leverage the resources to be able to provide those services.
And Rebecca, before you hop onto that next slide, I just wanted to respond to Dennis. He has a question in the chat about a copy of the PowerPoint. This PowerPoint and the whole recording will be posted to the Bonfire site. And we can, I believe that's the only place that we're going to be able to post the actual recording just for space-wise. So it will be available through Bonfire, I believe in the public files section. Michael, yeah, okay.
So I'm going to turn it over to Michael to give you some really good application hints on completing the application.
Yeah, good afternoon. And you can read what the hints are. I don't want to be insulting in terms of follow the directions. So obviously, yes. There is a document library in the files. We are pretty methodical and deliberate about what it is we are soliciting in services. If you are an organization and you're looking this as a funding opportunity for the services that you are currently doing or that you've been doing without public funding, and maybe we can get this public funding to continue supplementing those resources, odds are that's not going to work. When we do a request for applications, we are being pretty specific about what kind of service, what kind of product it is we are asking for. So please, please, please do read the application instructions thoroughly. read the questions that we are asking you to respond to in the proposal. Make sure you do understand them. Make sure you are answering that specific question, and look in the files section at the document library. When we are using terms like housing first, rapid rehousing, trauma-informed care, housing-focused services, all of those things mean very specific things. We do provide in the files, in the document library, what each of those things are, what service models we are looking for. And when we do when we review these applications, there is the subjective scoring, which is going to be done by the review committee, not by staff. And there is objective scoring that is going to be done by staff. The objective scoring is basically a pass-fail. It's really to make sure that you are a responsible entity that's submitting the proposal, and meaning that you have the infrastructure and the administrative capacity to receive these public funds and enter in a contract with us. And we're doing a basic check to make sure that you are being responsive to what it is that is being solicited. So, as an example, if we are asking for housing-focused outreach services for homelessness, and you have a peer-based outreach team that is really focused on relationship building and making sure that people who are on the street and in encampments have the things the basic necessities to survive that environment, that's not housing focused outreach. What we are looking for in that solicitation is an outreach team that is basically providing active case management with the people that they encounter on the street. Yes, that they build that relationship. Yes, it can be peer-based, but it is actively working to get people off the street and out of their tents and indoors into housing. So if you propose something different, that's not going to work. If we are asking for outreach and what your proposal speaks to is shelter, that's not what we are asking you to apply under for an outreach category. Like another way of saying it, just as the bullet discusses, if we are asking for a boat or a space shuttle and your proposal is a Ford F-150, it might be a great Ford F-150, but what we are asking for is, in the proposal, would be either the boat or the space shuttle, whatever it is we're doing. So we will do our objective review just to make sure that you meet that basic criteria. And then, assuming your proposal does respond, it's responsive to what we are soliciting, then the Citizen Advisory Board, the Community Action Advisory Board, they will have the reviewers that will actually do the competitive scoring amongst all the proposals that are responsive to what it is we are soliciting.
Thank you, Michael. So some really important dates that you will want to put on your calendar. The first one is that the pre-application portion, the questionnaire that's labeled pre-application, is due October 31st, 2021. Your ability to ask questions for the entire request for application process is December 29th, 2021. The application itself is due January 5th, 2021. However, in Bonfire, it doesn't allow us to give you until 11:59 to have the entire day to submit that application. So it actually states 1/6 at 12 a.m. So just be aware of that, that's midnight. It will close off before the January 6th really gets started. The staff will be doing our internal review and may ask additional questions in January once the applications have all been received. We are going to be doing program presentations to the Community Action Advisory Board in March and April. When we get closer to those dates, we will send out an agenda so that you have more information about the date and time of those presentations. The Community Action Advisory Board will make their recommendations in May, and we'll notify you of that meeting also. And then those recommendations will be submitted to the County Council for approval also in May. And then we will begin contract negotiations and to have contracts start July 1st, 2022. So a really quick overview of the evaluation and selection. I know Michael has already kind of done a quick overview of this, but there's an administrative review that will happen as part of the pre-application process. If you are a new agency that has not worked with us before, we may ask for additional documentation about your agency to make sure that you have the fiscal ability to undergo a contract. We will also do risk assessments, but this will be done after the contract is awarded. So that will be done later in the process. The evaluation and recommendations will be completed by the Community Action Advisory Board in May. And there's more information about the Community Action Advisory Board at this link if you're interested to know more about the advisory board. The applications are both being scored on a 100-point system. The amount of points available per question is indicated in the application. And then some of those questions are scored based on specific criteria, the objective scores, and those criteria are listed in the application question. So now I'm going to turn it over to Beth to talk more about the homeless crisis response system specifics.
Thanks, Rebecca. You can go to the next slide, please. Okay, so this is big picture view. We have approximately just over $2.5 million available, with the intention of starting contracts July 2022 through June 2024, with the possibility of 1-year extensions. We typically contract for 2 years, and depending on funding, compliance, performance, other factors, look at extending those contracts for 1 year. The categories available under this RFA for the Homeless Crisis Response System are permanent supportive housing, rapid rehousing, transitional housing, homeless shelter capacity increase. That specific category is for subgrantees and agencies that do not currently hold a county contract as a shelter provider in the community. So again, homeless shelter capacity increase, listed as new beds, new programs, is for non-currently contracted providers of shelter services. Homeless shelter current provider service increase is to support our current providers, current subgrantees with Clark County Community Services contracts for shelter in meeting their system performance goals. So if there's a need to better hit your system performance measures, you may apply as a current provider under that homeless shelter capacity increase for existing providers. So 2 categories there. Homeless outreach is also available, targeted prevention, and a system support program, Rent Well. Go next slide. The funding available through this RFA include House Bill dollars, often called homeless document recording fees. There's usually used a few names for it. We commonly refer to them as House Bill dollars. There's local funding collected from real estate transactions. And we also have Consolidated Homelessness Grant. So CHG encompasses quite a few things. There's a longer definition in this slide, which you may view on the recording on Bonfire. Just to summarize, CHG is monies from the state sent down to the county in a contract, and it includes SDG, or System Demonstration Grant dollars. That's a subset of CHG. It also includes HEN and PSH for chronically homeless families. So there's a few funding streams in there. They're all technically under CHG dollars.
Before we move on, Beth, RJ is asking if the $2.5 million available is on an annual basis or for the total of the 2 years.
Yes, so the funds available are meant to be an annual award. So when you're putting in your application, your budgets, you're going to be listing that for an annual request. Okay. So the next few slides are really meant to give you a summary of the interventions that are available for funding through this RFA. Please know that these slides are not inclusive of all requirements, and it is expected that you read the Homeless Crisis Response System definitions, the RFA description, and the intervention specific program requirements. So this is not a full list. This is just a summary. Just want to put that out there. Each applicant is going to be responsible for referring to the files and reading all the documents in the library. For permanent supportive housing,
I just wanted to emphasize these categories are really important. I mean, this is what we are asking you to provide, depending on the category you're in. So make sure you do understand, because what model service that you are offering, and it is what we are soliciting. This is exactly, this is what is being solicited. So please, please, please make sure that you are offering a program fidelity that we are asking for. And different localities and different organizations might have a different approach to permanent supportive housing, transitional housing, rapid rehousing. We do put in, Beth is doing this overview because she's telling you what it is that we in Clark County are soliciting for our homeless crisis system, and it gets into more detail in the file. But when we do our reviews of the programs, we want your proposal to be competitively evaluated with another proposal for the same category, with both proposals meeting what the county is asking for in that category. So again, please do look at the file and understand what it is we are asking for and that you are offering it. Sorry, Beth.
No, thank you. I think it's important to stress because, again, not an inclusive list. So just a brief overview of some of the expectations with this intervention. So for permanent supportive housing, the ultimate purpose of this intervention is to reduce the number of persons experiencing homelessness by getting them into housing and retaining that housing. So serving people who are experiencing homelessness, getting them housed, keeping them housed, big picture wise. And then there's lots of information in the public files to go through what that actually looks like in program design. So some basic expectations are that you would engage with clients as needed to support their housing stability and retention, collaborate with the Housing Solutions Center. All referrals for these programs are handled through coordinated entry. There's to be no other access point to your programs. Coordinated entry is required for all of these interventions offering housing. We ask that you deliver services at the point of need, including in the community and other non-traditional locations. So field work, not restricted to agency offices. That you are able to support the complex needs of clients in a holistic and collaborative manner. So collaborations, working with street outreach, medical, behavioral, health, corrections, and so on. It should be a holistic program responding to any need that the client has. The staff to client ratio is 20 households per 1 FTE. FTE is defined as 32 or higher hours. And it's important to note all these interventions dictate the exact staffing ratios, the maximums that you may have. And I just want to emphasize that if you have a staff person working 32 hours in 2 programs, then you are only counting the time that's dedicated to the PSH program. So if you have 20 households and that's 1 FTE or requires 1 FTE, minimum of one full-time staff person for those 20 people, and you only have half of their time going into that program, you do not have a 20 to 1 FTE ratio. You have a 20 to 0.5, and you are not meeting that threshold. So we want to be really clear when you're writing your proposals, submitting your applications, please be sure that you're able to meet these staffing requirements and the client to staff ratios. You will need to explain how you're meeting those and how that time is specifically dedicated to those programs. Additional information for PSH, promoting housing-focused services, utilizing trauma-informed approach, applying a racial equity lens, and being culturally competent in service delivery. And you really taking a close look at your organization, using data for insights, understanding who are your staff, who is your board, how are you applying a racial equity lens, and what more can you be doing? Be knowledgeable of systemic barriers, including racism and other forms of discrimination that can present barriers, and utilize an anti-racist approach in your services and program design. Promote and utilize evidence-based practices related to, apologies, I have a typo there, related to permanent supportive housing services instead of rapid rehousing. And understand the intersection of homelessness, behavioral health, criminal justice system, and apply a restorative justice lens when possible. Okay, so as I said, a few of these slides are going to have very similar components. I know that everyone is able to read instructions and follow instructions, so I'm not going to go through each slide with as much focus on the similar items, but I will highlight the differences between the intervention types, just so some of those clear points are easily seen. So rapid rehousing is the next intervention available. The main purpose of this program is to reduce the number of persons experiencing homelessness by getting them into housing and supporting exits to permanent housing. Rapid rehousing is not considered a permanent housing placement. It is a program with the intention of having people exit to permanent housing or other housing options once they reach stability and they can maintain that housing stability. There's no time restriction applied from the county for rapid rehousing, but there are income limits for this program. So a lot of the information is going to be same as with PSH. So you're to engage with clients and support housing stability, work with Housing Solution Center and coordinated entry, practice field work and not restrict your services to agency offices. You will notice that there's a difference here in the staff to client ratio. For rapid rehousing, it is 30 households to 1 FTE. So a little bit higher than permanent supportive housing. The clientele is a little bit different than permanent supportive housing. And we're still seeing in this community, most clients that are entering rapid rehousing programs have very high level needs. Many are able to stabilize and find stability once they are removed from their homelessness experience, given their basic needs, given support options, and they have that housing as well. However, I will stress that while 30 to 1 FTE is the maximum, you may submit a proposal that has a lower staff to client ratio. A lot of clients are coming in with very high needs. The expectation is that if you're performing a rapid rehousing or other type of housing program in the county, you are responsive to those needs and you can adjust your program to meet the needs of the participants, even if that means adjusting your staff to client ratio. So if you have done rapid rehousing in the past and you feel that the 30 household to 1 FTE is too high, maybe a 15 proposal would work better for your agency, and that is completely acceptable. You may go below that maximum, you just may not exceed it in your proposal. Okay, next slide, Rebecca. Again, utilize a trauma-informed approach, apply your racial equity lens, be knowledgeable of systemic barriers, evidence-based practice, and understand intersectionality of systems. Transitional housing. Transitional housing has gotten a bit of a revamp in our community. So we are using this transitional housing as a bridge to housing stability or a bridge to PSH. So transitional housing is limited to 24 months. The ultimate goal of the program is to reduce the number of persons experiencing homelessness by getting them into housing and supporting an exit to permanent housing, whether that's independent housing, rapid rehousing program, permanent supportive housing, adult foster homes, a variety of exit options. But this is a time-limited program, and this is a program intended to serve highly vulnerable persons who are qualified or score into permanent supportive housing, and there just may not be a permanent supportive housing placement available. So same and similar criteria, expectations that you will engage with clients working on their housing stability and retention goals, work with Housing Solution Center, participate in coordinated entry for all the referrals, participate and make services available in the field instead of restricted to the agency office, apply a holistic and collaborative lens, collaborate with various stakeholders. For transitional housing and several programs, again, please do read the intervention specific requirements. Transitional housing does require collaboration with behavioral health at minimum. So you must have an established connection there Other programs also have the same requirement. Again, please make sure that you visit that file document and read the intervention specific requirements. The ratio for this program is 15 households per 1 FTE or per full-time employee.
Beth did mention this is getting a revamp, and just know that if you currently are operating a publicly funded, a county-funded transitional housing program here in Clark County, and you don't change the proposal, like what you propose in this RFA for transitional housing is exactly what you are doing right now, you will not be meeting the transitional housing criteria. So that said it, but I think it's really important for transitional housing providers, if they are currently getting public funds from Clark County, they understand we are asking for more intense services and a harder to serve, more vulnerable population to be served by your program. These really are individuals that qualify for permanent supportive housing that cannot get a permanent supportive housing placement yet. So your staffing, your service supports, they need to be capable of providing the supports, the households in your transitional housing program that they need. So, you know, please do go through the files, do look at what we are asking for transitional housing, and do make sure that you are offering that.
Thank you, Michael. Yes, I think that's an important stress. And if you notice, the ratio is lower for transitional housing than it is for permanent supportive housing. We are working with the knowledge that many people coming into this program will have a high level of need, and without having an established PSH program that may have existing supports, you know, may have a longer established connections. The expectation here is that new transitional housing programs are responsive to those needs and are able to manage crisis, support behavioral health through collaboration or direct staffing. So yes, please read the requirements. It's going to be crucial for your application. Additional items for transitional housing are going to be similar to other requirements. Again, housing focused lens, always focusing on housing goals, housing stability, promoting exits to permanent housing, utilizing trauma-informed approach, applying a racial equity lens and cultural competence services, being knowledgeable of systemic barriers, utilizing evidence-based practice, and understanding intersectionality of systems. Shelter. There are some specific in the definitions, the homeless crisis response system definitions, a document in the library. There are specific definitions on what shelter is and how to meet the definition of shelter. For example, we are defining shelter as a temporary housing placement indoors operating within Clark County. There's various shelter types, including day shelter, overnight shelter, year-round shelter, 24/7 shelter, different kind of categories under the definition of shelter. And it's very important that you read those definitions. If you are proposing, you know, perhaps something that's an outdoor shelter, it does not meet the definition of shelter as we have defined it and as we have requested it in this RFA. So again, please read your documents, refer to that library. The purpose of shelter is to reduce the numbers of persons experiencing homelessness by getting them into shelter and supporting exits to permanent housing. A lot of the information is going to be similar here. I feel like we've kind of restated the focus on housing stability plans, coordinated entry, delivering services in the field and not restricting that to agency offices, supporting complex needs. And just to note that the staff to client ratio for shelter is 1 to 25. So shelter is falling in the middle of permanent supportive housing and rapid rehousing as far as reasonable caseload sizes and our recommendation to achieve targeted outcomes, which is a minimum 50% exit to permanent housing. Additional shelter information. Again, this is going to be fairly similar. An added item in here is that all shelters are to be housing focused with the barriers of shelters guests identified within the first 48 hours. And staff will immediately be began working with households to alleviate housing barriers and link with housing options. Again, always gearing in, what is your housing plan? Shelter is not the housing plan. What is that plan for you? And working quickly to identify that with your guests. Additional information is mirrored through the remaining slides. So we'll go ahead and skip through to the next section. Thanks, Rebecca. Homeless outreach. Purpose of this program is to connect unhoused persons to housing, services, and coordinated entry. So this is housing focused outreach. Again, as Michael was saying, if your focus on outreach is an application including delivering basic needs, hygiene, or food, that is very helpful to persons, and it is not housing focused outreach. We are looking for housing focused outreach. Again, please refer to the library document for more information on requirements. Information in here is going to be similar as well to other programs. We do ask that you collaborate with other stakeholders. You employ your housing focused approach. You're connecting people experiencing unsheltered homelessness with coordinated entry, including having your staff trained on housing and vulnerability assessments. That you connect with various service providers to meet the needs of clients experiencing homelessness, including medical, behavioral health, corrections, first responders, law enforcement, and others that may be relevant to client needs. Utilizing a trauma-informed approach again. Apply a racial equity lens, be culturally competent in service delivery, knowledgeable of systemic barriers. Again, a lot of these are going to be the same and duplicated. This does have a requirement for the staff to client ratio at 20 households per 1 FTE. And your agency must be prepared to comply with CDC guidance related to street outreach, engaging people at increased risk of severe illness when contracting COVID-19. So after, in post-pandemic world, making sure that you have policies and practices for your street outreach teams that keep them safe and keep the people that they're engaging with safe as well, in our new kind of normal that we're dealing with. So that'll be a component as well, making sure that you are having practices to keep people safe. RentWell is a system support program. RentWell is a tenant education program. The primary purpose of this program is to provide resources, tools, education to households which promote housing stability. RentWell is owned by Transition Projects, Inc., TPI. TPI contracts with community agencies and individual instructors to allow the curriculum to be used according to its terms. If you are applying for RentWell, you will have to comply with all the TPI requirements, and you will have to be contracted with TPI to provide RentWell in the community. There's various requirements in here. Most of the information for RentWell is going to be directly from TPI's requirements. So making sure that you're distributing sign-up information, making it known how people can access both RentWell tenant classes and instructor trainings, also partnering with Longview Housing Authority, that you will plan and facilitate the Clark County Resident Landlord Tenant Act, RentWell new instructor training, so the portion of RentWell that applies to Washington State and information applicable there. And within 1 month of a certified instructor training through TPI. So TPI will host new instructor trainings, and then there's an add-on for Washington State information as well. Additional information here for the RentWell program. Monitoring is required. You must communicate policies and procedures with the RentWell landlord guarantee to keep all instructors informed of any new changes. You have to manage the RentWell landlord guarantee. Be knowledgeable of systemic barriers, including racism and other forms of discrimination. Promote evidence-based practices. Understand intersectionality within systems, and provide adequate staff to client ratios as dictated by the RentWell curriculum and guidelines available through TPI. I think that's everything for me. And does anyone have any questions on the homeless crisis response before we move on to CAP? Okay, and again, If any questions come up, please use the opportunity Q&A through Bonfire, and we'll answer questions just as soon as possible within 2 working days.
Okay, so if any of you are here interested in applying for an anti-poverty initiative under our community action programs, we're going to go over those specifics. So the anti-poverty initiatives for our community action programs are funded by the Community Services Block Grant. We receive both state and federal allocations of these funds. The current program eligibility allows services to households and individuals who earn up to 200% of the federal poverty level. However, this may change and may revert back to 125% if Congress does not permanently address this change. All services that are provided through our community action programs are determined through our community needs assessment. So all community action agencies are required to conduct an assessment every 3 years of the needs of people living in poverty. We just published the most recent community needs assessment earlier this year, and it includes direct feedback from 1,655 surveys of people and households with low incomes, and we covered seven areas of need: education, employment, physical health, behavioral health, housing, income and asset building, and support services. Although there are needs in all of those categories of services, this RFA is funding categories and services that were the most frequently identified needs in the CNA and for which there are no or other limited other resources for the programs. The eligible activities in this RFA include physical health for dental services or food assistance, income and asset building assistance for credit repair or financial planning and budgeting assistance, and then through support services for transportation assistance. The following high need activities are being funded outside of this application. That includes housing assistance through the Homeless Crisis Response System, RFA, legal assistance, and information and referral services. The following areas of need and activities are not eligible to apply under this application: employment, education, behavioral health services, services that can be reimbursed through Medicaid or Medicare, construction, rehabilitation, or maintenance of property, or the purchase of assets, including equipment and or vehicles. For the three categories of funding, we have just under $100,000 available for physical health to fund either dental services or food assistance or both. For income and asset building assistance, we have $86,000 total. And for support services, we have $61,500 available. So as we talked about earlier in the presentation, there are some library documents that we recommend that you look through. For the community action programs, this includes the federal poverty levels, current levels as they are right now, best and emerging practices for community action programs, the budget template, which is required for your submission of your application, the community action program RFA description and requirements, which is also signed and submitted with your application, community action definitions, a conflict of interest and debarment certification, which is a form that's signed and submitted, and then the letter of collaboration reference and examples. So this will help you with understanding the collaborations that we're looking for in the program. You can find these documents either on our website or directly on Bonfire. For these programs, we have a few requirements. All proposals, as Beth had mentioned, for the Homeless Crisis Response System have some general requirements that need to be followed. The contract period is the same for the Homeless Crisis Response System, starting July 1st, 2022, going through June 30th, 2024, with an option to renew for an additional year. We need all agencies and programs to follow the requirements in the Clark County Community Services General Terms and Conditions. Proposals must address a need identified in the community needs assessment, meeting one of those three categories. The contract performance must take place here in Clark County. And then programs may be required to enter accurate data into the Homeless Management Information System, or HMIS. And that's done no more than 10 days following enrollment into the program and by the 5th of the month following services provided. This is how we identify unduplicated services for the community, the services provided throughout the community. We also require quarterly and year-end narrative reports to be completed. All programs must include the following components in their program: peer support, trauma-informed approach, motivational interviewing, and cultural awareness. We ask that our agencies provide or assist the household with connections to other community resources and be supports that help them improve their safety and well-being and achieve their long-term goals. And we ask that agencies be staffed by a core of employees who are suitably trained to effectively use HMIS and trauma-informed services. And then programs must promote dignity and respect using the equity lens. And here are some requirements that would be a part of your program design. So community action programs can be quite an array of programs. And so if you have any questions about your program and what you would like to apply for, please don't hesitate to reach out and we can talk through what would be eligible through the application. After today, any questions will need to be submitted through the opportunity Q&A in Bonfire, and then we will respond within 2 days. Again, last day for questions submittal is December 29th. Now we'd like to open it up to any questions. You are a quiet bunch today. If there's no questions, then we will go ahead and be done 5 minutes early. Congratulations. And we will post this recording as soon as we can to the Bonfire website. Again, we will be doing another meeting on Thursday morning at 8 a.m. If you have staff that you would like to participate to be able to ask questions, we recommend that they participate Thursday morning, or you can view the recording once it's posted to Bonfire. So thank you very much for attending. We appreciate the work that you do in the community, and we look forward to seeing your applications.
I actually had a quick question, if that's okay.
Yes.
Is there a limit on the allowable indirect rate for these grants?
It depends on if they are federal funded programs that are being, if the program is being funded through a federal source. Local and state requirements, I believe the administrative rate will be 11%. And
Correct.
Michael can correct me if I'm wrong.
Does that include the community action? I'm thinking about the community action plan or community action, the CAP.
Yeah, so we can't, the state funds would be the 11%, but when you submit your application, you can, in the budget, you'll have the availability to put the administrative rate that you're requesting. There's also a question within the RFA about your budget.
But it's capped at 11% for those. Okay.
It depends on if the funds are federal. That's where it comes down to.
Okay. Which ones are the federal ones?
The community services block grant is a federal source.
Okay, and those mostly are related to the emergency homeless services. That
would be the anti-poverty initiatives, would be the community action programs. The homeless crisis response system is all state and local dollars, which will be capped at 11%.
Okay, I get it. Okay, so if we applied for the CAP grant, then we could use our federally negotiated rate. Is that what I'm hearing?
Yes.
Okay, that's good to know. All right, thank you.
Any other questions? All right. Well, thank you very much for attending today, and we will see your applications soon.
Thank you, and thank you, Rebecca and Beth.
Thank you.